Now we're talking about diagnosing polycystic kidney disease, and we spoke about all the modalities. So we listed imaging as like one of the top stuff for diagnosing polycystic kidney disease. So one of the imaging modality we can use is a CT scan, also known as a computed tomography. So it's more of like just trying to look at how images of CT scan will look like and how we can be able to describe the polycystic kidney disease on a CT scan. So this is the gross and this is the CT scan image of it. So you should know that it plays a very important role in diagnosing, and it will now help you to now know what level of damage this patient is at, so that you now know the type of treatment that this patient will need. So diagnostic utility. So it's very sensitive. It can dictate cyst, even if the cyst is so small. And the cyst is so small you can miss it out on ultrasound, but CT scan will always give you. Do you understand? So it's useful in patients that are obese or advanced disease. Assessment of disease severity. You can now know the total kidney volume. You can accurately measure the kidney size and cyst burden, which is very important for you to now know which level of disease this patient is at. Okay, so from that you can differentiate whether the patient is having simple cyst or complex cyst. Complications. You can identify hemorrhage, infections, nephrolithiasis, obstructions within the cyst. It dictates renal cell carcinoma. Okay, so it's more sensitive than ultrasound, it's more specific than ultrasound. It can give you a detailed anatomical mapping more than ultrasound. But the limitation is you are exposed to too much radiation, and you can take some contrast. The contrast they inject it to you so that it will make the image more clearer. So those contrasts could actually be toxic, nephrotoxic, still toxic to the kidney that you are trying to manage. Do you understand? So, but by and large, that's what we have for CT scans.